So we've come to our last presenter, and this is the INCA president, Mr. Hollander.
Oh, sorry. So, while she's bringing up myself, I just want to say, first of all, Christina, in the face of what that group went through with all the losses, for you to continue to make that happen is just very, very special. So thank you for doing that. And I just have to tell you all, I am just so in awe of what you all do, the passion, the commitment, the creativity. It's your work and your stories and the patient stories that you bring forward yourselves or through your members that really make it a privilege for me to serve in this role. So thank you for that. I'm glad we're making the progress we are making, but the sharing, the work that we have ahead, which we'll summarize very briefly in a few minutes, is just so important, and we have to broaden our reach too and bring more people into this very special organization. So thank you. Let me just quickly, I'm not sure how 5 minutes is going to go fast. Am I using the up and down arrow here, or what are we doing? Okay, so I would like to, I guess, end on this note of hope for a cure. I mean, that's one of our core missions here, and some of you are doing some research. We are in a very special position, thanks to a lot of people, including Josh Mailman, my board member and partner in so many of these outreach efforts to major donors. And some of you have helped us make connections to potential donors as well, because this is about neuroendocrine tumors writ large. We can't do all the research we'd like to do, but we can do more now than we used to. And if we can advance the progress in collaboration with your researchers or otherwise, it's in all of our interest to do so. So we have some opportunities. I want to make sure you understand what those are and mobilize your research community to the extent that you can with the resources you have in your countries, but also to access our resources. And let's see if we can really increase the momentum towards better treatments and cures. So we were founded in 2005 by a patient who had a very typical patient in terms of her late diagnosis and really saw very little in terms of what was going on in research. And so our mission is really to discover cures and develop more effective treatments for all forms of neuroendocrine tumors. In our first decade, we funded about $14 million. That's about to uptick significantly. I'll tell you a little bit more about our board of directors and scientific advisors in a minute. We take a very collaborative approach to progress, working with the research community, and many of the researchers in your countries will be gathering with us. It's an invitation only. We try to keep it small, but it's getting bigger every year as we bring more and more researchers together to share data, to share progress, to do things in a very even pre-published sharing of data way so that they can really learn from each other and hopefully in so doing advance progress. And we work with other organizations, foundations to also fund grants, so we don't only do it through our own resources or our own process for that matter. And we are, as you all know, committed to providing support through our education programs that you heard both George and Dave Metz referred to this morning. Some of these slides I actually used in Stanford, so if you want to go to the video, and you can skip that part. But there's some great resources there too. Some of you are live streaming, and we'll always try to make those available to you both before, during, and after our events. So let me just quickly, as I think I covered some of this in terms of our background. In terms of our focus, it really is all about funding research, primarily in addition to the education process. We fund research at all of the top centers in the States, and increasingly, and you'll hear more about this within the next couple of months, some of the major centers around the world by dint of our new Accelerator Grants. All of the money that funds the research is privately raised, mostly by me and my board and others, from family foundations, from patients, from families, from bequests, fundraisers that like some of the things you've seen here today that people do themselves or that we help coordinate. We get some pharma support for things like our newsletter, our education programs, but none of that goes into the research that we fund. And a lot of what our founding our founder was about was really the scientific basis to really get to the bottom of what causes, as I think we asked in the survey, these tumors to form in the first place, to grow, to hopefully learn how we can control them and defeat them. So I said we have a terrific scientific advisory group. George Fisher is the co-chair, obviously very clinically oriented, as well as basic science involved and respected researcher. We are looking to expand that group significantly over the next few years. Christy Thirlwell, who some of you heard talking just a couple of days ago, is the newest member from the UK of our Board of Scientific Advisors, and you'll hear some more about that going forward. It's a very rigorous review process, and one of the things that we bring even to researchers who may come forward in your countries or to some of your foundations or donors in your community, everything goes through a very rigorous scientific review. So to a certain extent, we can be a place that not only reviews, but also causes to make even more structured, valid, scientifically, some of the approaches that go forward. And we don't fund anything that doesn't meet with some very high standards of scientific review. And we've had funders, including family foundations, that have come to us who have funded other research. They didn't know what they were doing. It was the hospital that was serving them or serving their family member, and found some great comfort in the fact that they could send those researchers to us or otherwise fund research that had that kind of review process in place. And while it's a very rigorous process, when things like immunotherapy or big possibilities come up, we'll take those calculated risks for possible breakthroughs as well. As you know, we're seeking the best ideas from the top labs, and this year, for the first time, we've had a really strong global request for proposal that, let's just say, dozens of researchers in 14 countries, including more than a few in this room, applied for. Those, the winners, if you will, those who were selected will be announced in April. And many of the centers that were not successful are receiving their results over these next few weeks as well. It was very tough. You heard about what George said about, trying to really pick the things that they thought could really be breakthroughs in terms of our understanding. I think going forward, we're going to look even more to things that can not only unravel the biology of these tumors, but really translate into hopefully better treatments and cures. And again, in terms of our process, anyone we fund has to do progress reports. They're accountable to present at this meeting that we're talking about. So there's a real built-in accountability to the funds that is necessary for us to raise the money we do from the donors. I'll skip this, but basically it's really trying to not only do a lot of research, it's trying to build and sustain a community of researchers at the very top levels, maybe from other areas of cancer or research, who are committed to neuroendocrine research. And by bringing in brilliant young investigators and others to really build that community, and in so doing also increase the progress. And there's a number of different kinds of research projects we do. I announced some of this last year when we were here, that we had just received a major gift from the Margie and Robert E. Petersen Foundation. This is, we believe, the most ambitious research effort ever undertaken to really seek to cure and control NATs. We're hoping to use these grants in these few years where we have that level of funding, and hoping then to raise our level of funding to sustain that level going forward to really accelerate progress. And our board is struggling with the best way to do that. And Josh is part of that discussion now, which I'm really pleased about. And by the way, we would have never gotten that $15 million gift over 3 years, $10 million we're putting right to work, $5 million that's going to sustain this building of the bench, if you will, the young investigators for the future on an annual basis. We wouldn't have gotten it just because of our track record or whatever, without some real credible third-party validation from other foundations we had worked with, and quite frankly from patient leaders like Josh Mailman, who was really part of really in a very personal way, but in a very informed way, as you all have known to know Josh, that these people were making not only a wise investment in a process, but an investment that had the confidence of patient group leaders and other charitable foundations. So thank you again on behalf of all of us, Josh, for your role in that. So So what are we going to do? There are 4 big areas here. I'll come back to where we are now, but the biggest piece is cracking the code of the tumor biology. That's the question we asked. That's the question that most of those surveys said, we want to cure. Let's figure out what it is that makes these tumors tick so we can turn them off. And whether that's in terms of early diagnosis, biomarkers, models that we can use to really test new treatments. Targeted therapies, things like immunotherapy or other potential, and there's several of them. We were talking yesterday with some of our advisors here at ENETS or the day before, including things like how do we look at and possibly improve PRT. That's a whole other conversation about what is or isn't going to be approved and what yet needs to be done to improve the process, the treatment, and maybe even improve the cost to our patients. Building and sustaining a strong bench, as I mentioned, very core and very important, by the way, to the Petersens, too, that they were going to have something that was going to continue to yield results, and then supporting patients and families. I better speed up or somebody's going to ring a glass in a minute here. So the accelerators were a whole new dimension. Thank you. I did it to you, too. It's okay. So we're really looking for the top labs. Then we're trying to overcome the barrier of not having, you've heard these things like cell lines and mouse models, and none of them are any good. And we're really trying to solve that one as well. And then a deeper dive in terms of all of the genomic, epigenomic, now they're talking about proteome. I can't even say all the things, but where is that clue, that switch, that door that we can open, that we can exploit because we found something and we know there's a drug that in another form of cancer is effective for that pathway, and finally we have something we can really test patients for and hopefully use. The Accelerator Grants are a whole new thing for us. I'm going to not get into these details. I'll share the slides, and of course we'll make all the slides available to everyone in terms of that. And you'll hear about those announcements in a couple of months rather, not a couple of years. So here's where we are. The Accelerator RFP went out. We had a very robust, and thank you. I think a lot of you put that into your newsletters and publicized it and helped us. I know there are some people I've seen in each of your countries, even over the last few days, who didn't get, it was a pretty short time frame, didn't get an opportunity to really put in the kind of proposal they wanted to, and we said, come on back, we're going to be doing it again, hopefully in the late spring, early summer. And we're going to bring those new teams that we'll be announcing together, again, whether it's kind of a dream team of top labs in different places working on different elements, so that, again, they can learn from each other and they don't do their work in silos, waiting until there are publications and everything else, really accelerating the progress. We're also looking to partner, and so we have some really exciting new relationships now with NANETS. So we're funding a basic transitional science investigator through NANETS for the first time. We're going to do that again. We've made a commitment to do that on an ongoing basis. The Educational Research Foundation is in the area of nuclear medicine, and so we did a pilot grant there this year on a new delivery form for PRT. Wonderful researcher in the California area. We're going to make that, we're going to renew that commitment as well. So building up that bench, and of course you all know we're funding our research into unmet needs through a $50,000 grant here. And it's going to be really critical, as I said before, in any pathways that you see that doesn't compete with your own efforts to raise money for people who might be interested in specific areas or general areas of research. Let me know, because we've got to sustain this level of effort if we're going to be able to get to a cure. I'm going to skip some of this and get to immunotherapy. I reported on this 2 years ago. These projects are going forward, and as Kathy mentioned earlier, we've just renewed the grant and extended it actually to Tim Mayer. So all three of our teams looking at very deep analyses of the microenvironment of our tumors. Where is it? You heard some of this, I think, but I still don't connect all the dots here as to what does or doesn't seem to work in other cancers. So far, we haven't found quite the same locking key mechanism, if you will, for our tumors. We've got three of the top teams, including here in the UK, as well as in Boston, and a new researcher in at MD Anderson, who I have to tell you is not only so excited about what he's doing, but is also using the word clinical trial in a semi-public forum. So we're very hopeful about taking those basic results and turning them into something like that. We're still working with that group in Pennsylvania. That amazing video, which I brought along, I've embedded it into the video, into the slides, so you can all watch that if you want to again. But that's amazing work. We're still looking for the way to apply it, and that's our team there. David Metz on the clinical side, Xinjin Hua, who's a very basic MEN1 and general neuroendocrine researcher, and of course Carl June, who's a rock star in cancer research circles, if you ever go to those meetings, in terms of his immunotherapy work. Okay, and then these are the partnerships. Obviously, this is last year's picture for me. We'll substitute it with this year's picture now and all the wonderful work we're doing here, trying to reach out to the international community for the best ideas, working with INCA to carry our message of the needs going forward and collaborating with ENETS and others to find out what the unmet needs are that we can address in research. I mentioned the NANETS and the Education and Research Foundation grants. So at the end of this is that video, and if you want to see something that's both inspiring and moving, spend 4 minutes watching that. We won't do that now because we have to wrap up. So any questions? Are you getting questions about the Accelerator Grants? If you are, just send them to me. And Josh, as a board member, one of the things I didn't say, our board is made up of people who are all directly connected to the disease. They're either patients, as Josh is, they're spouses of patients, one's the father of a patient, and they're people who have lost loved ones to this disease. So they're all really connected and really push us and push our researchers to do stuff that's really going to move the ball downfield towards better treatments and cures, and it's pretty special. Okay.